The case of Carla Staple, an interdisciplinary approach to care. Carla Staple is a 79-year-old Vietnam veteran living in a rural town with her husband, Hank, and their dog, Georgie. Floods have left their home unsafe, so they are staying in an emergency shelter. Mrs. Staple has many chronic health conditions exacerbated by the stressful situation. The floods have also disrupted the lives of her closest supports, adult children, Anthony and Janie, compounding the family's stress. Continuity of Mrs. Staples' care has been disrupted because the VA care system that she uses cannot communicate with the local FQHC handling the emergency care, leaving the family wondering how to get Carla the care and medication she needs in an affordable way.
Here we have a list of the presenting concerns for Mrs. Staple. The most pressing medical concerns are the infection of her prosthetic site, confusion and cognitive decline, and the effective management of her lupus and rheumatoid arthritis. We will also focus on factors contributing to her loss of mobility and independence. There are also dental concerns noted, such as ill-fitting dentures and jaw pain, which we will explore. Finally, there are several biopsychosocial factors impacting Mrs. Staple, which need to be addressed, such as widespread financial constraints, the disconnection with her primary care team at the VA, home restoration needs, and lack of care coordination and caregiver support. Mrs. Staple and her family are a fundamental part of the care team. We will work together to coordinate a plan of care that focuses on Carla's cultural and personal values, which include her family, to include their dog Georgie, military service, her church community and spirituality, hobbies such as cooking, maintaining independence, and staying in her home. Incorporating these values throughout in all aspects of the care plan will help to build and maintain trust with the Staple family. Ultimately, our care plan will aim to improve the quality of life for Mrs. Staple and her family by providing the care, support, and education necessary to get her home and reintegrated back into her community as quickly as possible.
In caring for Mrs. Staple and her family, we are guided by the 5M's geriatric framework, which ensures a holistic approach for the geriatric population. This framework focuses on 5 key components: mind, multi-complexity, medication, mobility, and matters most, which will all honor Mrs. Staple's personal goals and preferences. Next slide, please. I introduce to you our interprofessional team that will provide care and support for Mrs. Staple and her family. Joseph Bean from Mazdo, a dental student covering dentistry and nutrition. Melanie Bemis from Mazdo, a dental student covering pharmacology, counseling, psychiatry, and psychology. Gretchen Hurley from VCU, a nursing student representing nursing and rehabilitation medicine. Priscilla Torres from NSU Fort Lauderdale, a physician assistant student representing the PA and care manager. Amanda Wang from U of L, a social worker student covering social work and is also the VA liaison. And finally, our team coach, Dr. Leland Waters. Together, we will ensure coordinated patient-centered care for Mrs. Staple and her family. Next slide. Our multidisciplinary team, including the physician assistant or PA, nurse, physician, and care coordinator, will begin by evaluating Mrs. Staples' condition and activating the acute medical phase. While several lab abnormalities require follow-up, our immediate priority is a suspected prosthetic joint infection. Mrs. Staples' fevers, chills, and decreased responsiveness in the female shelter raise concern for systemic infection. After discussing these findings openly with Mrs. Staple and her family, our team strongly recommends immediate transfer to a VA acute hospital for admission and treatment. Upon admission to an acute VA hospital, empiric IV antibiotics such as doxycycline will be started in coordination with pharmacology, infectious disease, and orthopedics. A sepsis bundle will be initiated, including blood cultures and imaging, to determine the infection source and stabilize her condition. Throughout this process, the care coordinator will track progress and send reminders to the team when follow-up is needed. The nurse will provide clear explanations before procedures, and the PA and physician will review lab work with the family, explain any of the risks and benefits of every option, and participate in interdisciplinary rounds with all specialists involved in Mrs. Staples' care. As Mrs. Staples' acute condition stabilizes, it is vital that Mrs. Staples is sent to a VA subacute rehab facility that will provide continuity of care. The medical team will communicate with the VA social worker to help her connect with the VA and community resources, and also recommend referring Mrs. Staple to a geriatrician if available. One major advantage of the VA system is its integrated electronic health record system, or EHR. It will store Mrs. Staples' diagnosis, medical conditions, imaging, and past labs all in one place. The EHR will prevent any missing information. It will improve coordination among different specialties to see the same updated information and the ability to communicate through shared notes. Next slide. In the chronic phase, the primary care provider, or PCP, will routinely check progress notes from each specialist to share the results with Mrs. Staple on each visit. The PCP will educate Mrs. Staple and her family on the importance of staying current with the shingles, pneumococcal, and influenza vaccines due to her age and chronic conditions. The PCP will also stay in close communication with the wound care specialist to monitor energy changes at the prosthetic site and teach the family proper wound care. A DEXA scan will also be ordered, which is a low radiation imaging test that measures bone density and assesses fracture risk, given her long-term use of prednisone and also her reduced mobility and postmenopausal state. The team will also monitor her renal and hepatic function closely, as several of her medications can cause liver and kidney toxicity. The PCP will also promote lifestyle change modifications to manage Mrs. Staples' hypertension and high cholesterol. We'll begin by tracking lipid levels, blood pressure monitoring, checking iron panels, and monitoring for lupus and rheumatoid arthritis flare-ups. Medication adjustments will also be made with the help of rheumatology and the pharmacist. We'll begin by trending lab values to ensure safe prescribing. The care team will reinforce healthy dietary habits to support wound healing and chronic disease control. The PCP and care coordinator will refer Mrs. Staple to various specialists listed below, and the care coordinator will organize brief huddles of virtual meetings where each specialist can provide an update on specific progress goals throughout her care. Finally, the care team will meet with Mrs. Staple and her family to discuss home healthcare options, establish a healthcare proxy and advance directive if it's not already in place, and ensure her wishes are honored. Guided by the geriatric 5Ms, especially the component matters most, we will keep Mrs. Staple at the center of all decisions while keeping her family informed at all times. Next slide.
In the 5M geriatric framework, medications are evaluated on a monthly basis by consulting pharmacists who use the Beers criteria and specialize in geriatric care. Problems associated with polypharmacy are common with geriatric patients, as more drugs increase the likelihood of adverse drug effects and dangerous drug-drug interactions that put patients at risk. Immediately upon VA hospital intake, our VA consulting pharmacist recognizes several medication errors to immediately address. For acute pain and infection, ibuprofen is switched to acetaminophen and doxycycline added until a definitive diagnosis is reached. Azathioprine is stopped. In consultation with the counseling team, sertraline is added for anxiety and depression. Because her hyperlipidemia issues aren't as pressing, her dosage can be later increased along with prescription of diet and exercise therapy. Monitoring of xerostomia by her dentist and lipid panels by her PCP will inform potential adjustments. This data will be tracked in her EHR. Her hypertriglyceridemia demands immediate attention, with fenofibrate added at VA intake. Her hypertension therapy, amlodipine, will go on monitoring status. Changes can be made later in the chronic care management phase if needed in coordination with her dentist and PCP. At initial intake, our pharmacist recognizes mishandling of her RA and SLE drug therapy. While prednisone must be safely tapered down and hopefully eliminated later on, azathioprine can be replaced right away with the first-line treatments of methotrexate and hydroxychloroquine. She must also start supplementing with folic acid, vitamin C, zinc, vitamin D, K, and calcium to help restore her health and prevent potential problems with her new medications. Melatonin can help with sleep, potentially boosting her mental health. To monitor Carla's drug therapy, regular lipid panels, blood pressure readings, complete blood cell count, and iron levels are entered into Carla's VAEHR and discussed on a regular basis with her PCP and interdisciplinary care team. The pharmacist will ensure Carla and her family are educated on side effects to look out for. The inclusion of our VA consulting pharmacist on the team will get Carla back on track and allow for safe reductions and changes to medications that improve her healing, slow disease progression, and improve her quality of life.
Here we are exploring the role of rehabilitation specialists as Ms. Staple and her family navigate transitions to the VA. First, we'll touch on the essential role of nursing. Nurses are often the backbone of rehabilitation, providing daily support and advocacy while building trust and confidence in the care provided to Ms. Staple and her family. They will assess and monitor for side effects, evaluate progress toward treatment goals, and coordinate interdisciplinary care in collaboration with care management and social work. At the bedside, nurses act as the eyes and ears of the care team, alerting them to any concerns. Nurses can also educate Ms. Staple and her family about medications, potential side effects, and safety, complementing the guidance given by ordering provider and pharmacist. Additionally, nurses encourage family involvement and support good nutrition and mobility, and assist Ms. Staple with activities of daily living. Next, we have physical and occupational therapy, or PTOT. They're working on mobility, which is one of the 5 M's of geriatrics. These specialists help prevent further deconditioning and loss of function, supporting patients in regaining mobility and independence. And they create personalized plans to improve physical function, safety, and overall quality of life. Early inpatient mobility has also been shown to reduce signs and symptoms of delirium and decrease overall hospital length of stay. Ms. Staple can perform many activities at wheelchair height, and PT will determine whether she will require her own wheelchair and assist her with safe transfers. PT will also reassess her grip strength, develop an individualized strengthening plan, and document her progress in the electronic health record. PTOT can also collaborate with orthopedics and the manufacturer to optimize her prosthetic fit and help her use it safely when appropriate for her stage of wound healing. Additionally, PTOT can provide adaptive devices such as a modified toothbrush for weak grip and teach her husband techniques and equipment to support safe mobility and promote independence with activities of daily living at home. She can continue PTOT in subacute rehab and later transition to home PT through the VA. PTOT will also make recommendations to the family, provider, nurse, and case manager on mobility and discharge recommendations. Speech-language pathologists also play a crucial role here as well. They can assess not only her speech, but also chewing and swallowing capabilities. This is essential for making personalized diet texture recommendations to the provider and registered dietitian, especially when dental health or swallow coordination affects the diet choices. These recommendations can be evaluated after her dental appointment or when she returns home. Lastly, hearing specialists or audiologists are an important part of her care too. Regular hearing tests are recommended every 1 to 3 years for adults over 65, and it is important for Ms. Staple and her family to know that they can contact the VA directly for hearing aid checks, fitting adjustments, or even replacements via telehealth or in-person visits. Ongoing follow-up helps ensure she maintains optimal hearing health, which is vital for her understanding and participating in her care plan. Overall, rehabilitation specialists work collaboratively to develop a comprehensive care plan aimed at restoring function, preventing delirium, easing depressive symptoms, and improving the Staples' overall quality of life. Throughout each care transition, they help maintain mental and physical goals and involve the family at every step. Next slide.
So moving on to dental concerns, Mrs. Staple presents with 2 chief complaints to our clinic, those being ill-fitting dentures and jaw pain. So for her dentures, she has an upper and lower partial removable that she's reported have not been fitting as well lately as they used to. This has caused difficulty in chewing and reduced her oral intake. Mrs. Staple shows signs of malnutrition, so we want to ask her how long she's been having this problem to see if that could be one of the causes of it. This could be being caused by her oral hygiene or medications, which we'll get into momentarily. So we would want to find out where the dentures are catching in her mouth. And if it seems to just be from standard oral wear, we'd want to work on fixing those right away. But if it's going to require more extensive treatment, we may need to bring a prosthodontist onto the care team. Her jaw pain could possibly be being caused by generalized caries, periodontal disease, or TMJ pain. So we would want to do a full external and internal oral exam to assess any potential TMJ dysfunctions, as well as do a full perio charting where we'd measure pocket depths, bleeding on probing, gum recession, tooth mobility, plaque and calculus, and more. So her jaw pain could be being caused by oral hygiene again, or medications, or nutrition-related factors. So moving on to her dental hygiene, as mentioned before, Mrs. Staples has rheumatoid arthritis and a weakened grip strength. So this is exacerbated by the fact that she's using a manual toothbrush since she lost her electric one in the flood. So we'd want to replace that as soon as possible. And then also recommend that she start using a water flosser, since this is significantly easier to use than thread floss. And it's very important for a patient to be flossing, preferably 2 times per day. We would include that in her education, as well as making sure that she's brushing 2 times per day. And then other barriers that we may face in her treatment may involve cognitive or mental health decline problems. Her recent trauma has obviously caused a big hit on her mental health, so we would want to see how she's doing there and connect her with our mental health care team. And then her cognitive decline could be due to age, or it could also be due to infection at her prosthetic site. So hopefully the infection has already been handled by our team before this visit, but her mental health concerns may be an ongoing issue. Her hearing aids also, if not fixed by now, could provide an extra barrier to communication. So going over medication concerns, we'll reemphasize how they can affect her oral health specifically, starting with amlodipine. Amlodipine is known to cause gingival overgrowth, which we'll be looking for during the intraoral exam. This could be one of the main factors attributing to her ill-fitting dentures. Pravastatin causes dry mouth. This is worsened by the fact that she reports that she drinks very little water. So this is a major contributor to any issue of the oral health. So we'd want to do a salivary flow rate test and coordinate those results with the pharmacist to see what exactly is going on. Then azathioprine, prednisone, and ibuprofen, they all affect infection, delayed healing, and increased bleeding. So we would have to coordinate with our primary physician before carrying out any extensive treatments like extractions or implants if necessary. Prednisone can cause osteoporosis or reduced bone density, which would cause an issue for her jawbone. This could be causing her TMJ pain, which could also be another causer of her ill-fitting dentures. So we would want to be assessing whether or not there's any problems there and keep an eye out for gum recession or tooth loosening or tooth loss that could be associated with prednisone. Prednisone also increases the risk of infection. So we'd want to be looking for that during the intraoral exam, looking for candidiasis or any other infections that may be causing problems. So we would recommend to closely monitor prednisone as well as communicate all these concerns to their primary physician. Next slide, please. So Mrs. Staples' nutrition, she's been exhibiting classic signs of malnutrition lately with dark, hollowed eyes, various bone protrusions, weakened grip strength, and brittle nails and thinning hair. She didn't have the best diet even before being admitted into the shelter, but it hasn't been made better since moving in there. She has highly processed foods, a lot of frozen, canned, and packaged foods that are high in sodium. She also reports a high sugar intake, such as sweetened tea 2 times per day, regular ice cream in the evening, and also a very low water intake. She says she only has 1 to 2 cups per day, which is a big concern with her high sodium diet, as well as pravastatin, both contributing to dry mouth. So we would want to educate her, make sure that she's reducing her salt intake, which is especially important for her hypertension, as well as reducing her cholesterol and saturated and trans fat intake, which is important for her hyperlipidemia and also for her pravastatin dose, since that drug functions best with low cholesterol as well as exercise. We'd want to make sure that she's drinking more water and then suggest healthier alternatives for her, like leafy greens, low-fat meats, whole grains, and healthy dairies. And then due to her recent mental health decline, it may be particularly difficult to teach and also for her to maintain these new good habits. So that's why it's especially important for us to arrange a meeting with our mental health care team as soon as possible for her. Next slide, please.
Psychiatrists and psychologists address the focus area of mind within the geriatric 5M framework and make up our VA counseling team. Carla has previously suffered from PTSD, depression, and anxiety. Her social withdrawal, self-framing as a burden, and flare of anxiety related to the flood and emergency shelter suggest mental health intervention is needed. To keep patient and family trust, our counseling team will discuss treatment options with Carla and her family, and then collaborate with her PCP to track progress. In individual and group therapy, Carla will identify educational and group activities to invest herself in and plan how to regularly attend. Involvement in these programs often improves or resolves depression and anxiety in seniors while maintaining cognitive function for longer. Many engagement opportunities are offered through local libraries, community colleges, and senior connection centers. Coordination with our social work team is important for this aspect of the care plan. Senior transitions bring challenges to spouses, partners, and children. Hank and Carla can benefit from couples counseling sessions to identify and overcome specific stressors related to the flood, aging, and chronic healthcare conditions. Maintenance of strong family ties with adult children plays a key role in successfully navigating these. Family counseling will target continuation of the strong parent-child relationship already present and help the family decide together future living arrangements and management of increasing care needs. Caregiver family therapy will be important for Hank, Anthony, and Joyce since they share this role. Family caregivers face many mental, emotional, and physical challenges. This therapy will help them add more communication, empathy, and coping strategies to utilize as they work through caregiver demands together. Any declines in their mental or physical health or having maladaptive coping skills and increase Carla's likelihood of falls, declines in functional abilities and pressure source, etc. In their totality, these interventions will strengthen Carla and her family's mental and health resilience, improving their quality of life.
There are 3 main areas to focus on for the social work care coordination based on the Staple family values and their needs. For medical, it was identified that Mrs. Staple did not have reliable transportation to get to the nearest VA medical center, so we would assist her in coordinating that. I would also work with her and her family to complete the VA Decision Aid for Care Management form to make sure they are aware of all available options and allow Mrs. Staple to make the decisions that she wants for her care. Mrs. Staple prefers non-institutionalized care, so a few options that can support that desire would be the VA Medical Foster Home Program and home-based primary care. Finally, I would work with Mr. and Mrs. Staple to complete her advanced care directives as soon as possible. To address the Staple family financial concerns, we would want to contact their mortgage lender as soon as possible to see about loan deferment options. I would also get them connected with someone who can help them navigate their insurance claims. I would also encourage Mrs. Staple to submit for an additional VA disability rating for her service-related PTSD, lupus, and hearing loss, which could help increase their monthly income and possibly qualify for her for additional VA services. There are several home modification programs through the VA. These grants can assist in adapting the home to make it easier for Mrs. Staple to move about and regain some independence in her home. They may also help bridge a financial gap from insurance coverage when repairing their home. Some other resources that we would assist Mrs. Staple and her family with are contacting FEMA and applying for disaster assistance. It's also very important that Georgie is taken out of the emergency shelter immediately with the ultimate goal of family reunification as quickly as possible. There is a pet foster program through Guardian Angels for Soldiers Pet, which may be a good option until Mrs. Staple is stabilized and they are able to get back into their home. We will also work with Carla's physician and mental health team to get Georgie registered as an emotional support animal, as that may help speed up the process of reunification. The Area Agency on Aging is a great resource for additional care within the community and may be able to connect the Staple family to nutritional resources and additional caregiver support. The veteran service organizations such as the VFW or American Legion can assist Mrs. Staple with submitting for additional VA benefits and can be a good source of community connection. There are also several caregiver support programs available to the Staple family, both through the VA and other organizations. These programs can provide training and support for the caregiver and may also provide financial compensation if Mrs. Staple meets the eligibility requirements. The social work team will continue to collaborate with the care manager, interdisciplinary team members, and the Staple family to identify and address any additional needs. Next slide.
So for our team process, we utilize the 5 M's of geriatrics to frame our approach to this case. For ethical considerations, we really had great teamwork from different disciplines, but being direct with each other, working together with respect, and valuing each other's opinion really helped. Lessons learned, we really worked together on a complex case. It was a challenge, but having strong dedication and work ethic and showing up made all the difference. Our challenges were met by our strengths in the group, coordinating schedules and speaking to disciplines outside of our scope. And one of our group members, Melanie Bemis from Dentistry, found an error in the case regarding cholesterol levels. We taught each other and sought out information from disciplines to grow and reach out of our own roles. This was a great experience overall for our team. Next slide. This is our AI slide. We used Canva AI for graphics on slide 4, and we used a ChatGPT to format some of the references that we have following our presentation. Next slide. Here's our references, and we just want to say thank you so much for listening to us.